Friends, this is my first video on YouTube. So I was really reading carcinoma of ovary, and the staging of carcinoma of ovary was really a Herculean task for me. So I just made a picmonic for carcinoma of cervix, that is FIGO 2014. It's the latest staging of carcinoma of ovary. As you can see, this is our carcinoma of ovary is a really important staging, is really important, as it's asked in vivas or mcqs. So let's see how staging is done. So this is my first video on YouTube, so please forgive me for any this bad video quality. Now let's go. So let's see, in stage 1, I have drawn two ovaries here. So the carcinoma is limited to the ovary, not uh, anywhere beyond this boundary of ovary. So let's see, there is stage 2. In stage 2, I have made just its outline of pelvis. So first I have to make this pelvis. So this is really a pelvis, so just take it as pelvis. So it limited below the pelvic brim, so it is limited below the pelvic brim. It's below the pelvic brim. In stage 3, it is beyond pelvis, that is, it's beyond pelvis, that is true pelvis, pelvic inlet. And lymph node may be involved or may not be involved. And in stage 4, you see it has distance metastasis. Distance, there is no end, going on, distance mets. So now let's see carcinoma of ovary, that is staging in detail. So see, carcinoma it consists of stage 1, that is T1. It has T1A, B, and C. And C is further divided into 1, 2, and 3. Now let's see A. A means one ovary involved, that is capsule is intact. One ovary means A. A means A, B, C. So A is 1. So it is one ovary involved. And B, both ovaries are involved. Capsule is intact as A. So both A, B, 2. Now let's see C for capsule. So in these two, capsule are intact, but in this, capsule ruptures. So 1, 2, and 3. So there is surgical spill. During surgery, you have to spill this ovarian carcinoma. So in stage 1, there is surgical spill. In stage 2, there is a spill before surgery, or tumor is in the surface of ovary or tube. Okay, before ovary, before surgery. So in 3, there is malignant cell in ascites. Malignant cell in ascites. So where we tap the peritoneum, there is a malignant cell present. So in stage so in C3, there is malignant cell in ascites. Now coming on to stage 2, which is really very easy. So I would like to focus in this. In stage 2, we have uh, tumor below the pelvic brim. So in stage 2, let's see T2. It is further divided into 2A and 2B. In 2A, there is a uterus involved with or without fallopian tube. Okay, it should be below the pelvic brim or primary peritoneum cavity. So in B, other pelvic tissue or other pelvic intraperitoneal tissue, other than uterus and fallopian tube, other pelvic tissue, intraperitoneal tissue are involved. Now let's see the most difficult part of this staging. I have made it really simple to understand. Stage 3 is beyond pelvis, that is, it has involved beyond the pelvis with or without lymph node. So let's see. So in stage 3, there is cytologically, histologically confirmed stage to outside the peritoneum with or without retroperitoneal lymph node involved. So let's see, it is further divided into 3A, 3B, and 3C. So in case of 3A, there is a retroperitoneal lymph node involved or with or without microscopic methods. Now let's complete this thing. 3A, there is retroperitoneal involved and microscopic methods. So in stage 1A1, there is we have two things, retroperitoneal and microscopic. So in 1, we'll go for only retroperitoneal lymph node involvement, and in stage 2, we will go for microscopic methods, that is the primary thing, and with or without positive RBL means retroperitoneal lymph node. And so positive retroperitoneal lymph node only, it is further divided into 1 and 2, that is mets less than 10 centimeter and more than 10 centimeter. In case of B, there is macroscopic mets, that is less than 2 centimeter, sorry, 2 centimeter, with or without retroperitoneal lymph node involvement. And in stage C, there is macroscopic, there is both in this macroscopic mets less than 2, in this macroscopic mets more than 2 centimeter, with or without retroperitoneal lymph node involved. It includes the capsule of liver and uh, capsule of spleen. So let's see, I would like to say here is very important part, that in this, in A1 there is T1, T2, N1, T1 or T2 or N1 involved. It is also known as T3A, and this T3B, and this is T3C. Now coming to the easiest part, that is stage 4, very easy part, that is M1, metastasis 1. A, it is further divided into A and B. A consists of pleural effusion plus cytology, and B consists of parenchymal mets. Okay, let's